Tips for attacking the overwhelming feeling associated with broad collaboration when it all seems too big. Like, what are some tips that you could give for tackling that?
That is a hard question. I think that first of all, I think back to some of the stuff that Barb was saying in the panel, and that is to think big in the sense of, yes, we need to think of the wider dynamic systems driving all these complex problems, and we need to think of the social terms of health in this particular field. But we need to make sense of them and make them into something we can actually act on. So it's kind of making those complex challenges actionable and understandable. And that generally does mean start with something quite concrete. And to some degree then, if we're talking about collaboration, you then build a collaboration around the issues, whatever they may be, or maybe around a neighborhood. I mean, there's been lots of innovative examples of local, really grassroots neighborhood stuff. And then starting to see, well, all right, we live here, but across the road over there, it's pretty similar, and we can learn from them, and we can share some resources and so on. But anyway, some tips for good collaboration. I think it's, don't worry too much about the lineup. Sometimes, especially in more formal terms like, a ministry or a hospital or a LIN or a municipality, you think of stakeholders, in capital letters. And so we got to get business, we got to get the unions, we got to get the doctors. And at one level, that's true. I mean, these are all big players. They're really important. But you also have to hear from lots of different voices, lots of diverse voices. One of the big tips I've got just from my own experiences, so I work mostly in how do you actually drive health equity strategy into action. All kinds of different ways in different places. So, I'd often talk about a kind of toolkit or a roadmap or so on. But part of that, I think, is bringing people together. So we'd often have at Wellesley, the Wellesley Institute, health equity roundtables. And mostly they were about, they weren't broadly about the social terms of health. We have some of those. But some of these would be about, well, how do we actually operationalize equity into health care? And so you have community health centers who are really, really innovative on this. You have some hospitals, you have some really good primary care types and so on. But what I always like to have is people from outside the field. And I think we heard of this in the panel, that kind of disruptive influences or the slightly out-of-the-box influences. So my little tip is if you're having a health services, health promotion type roundtable, get in some neighborhood center type people. Get in some local residents, just folks who live in the area. So because they're going to bring a different angle, they're probably dealing with the same kind of issues, but they're going to bring a different angle, and that angle is always going to be useful. And they're also going to be a bit of a check on, even the most innovative sectors like community health centers and public health. You develop a way of thinking, we all do. So you don't want to be going down that same path of even though it's a good path, you want to have some people who can say, hey, hold on now, have you thought about this? Have you thought about this other thing? Who's missing at this table? It's actually always a good thing about modern day collaborative politics that somebody's always going to pop up in most meetings and say who's missing.